A time comes in the life of every race when people are driven by echoes of the past to chart a course for an exalted future. Africa is at this threshold, as major actors in the Africa arena plot a renaissance towards common destiny. Let's pedal across the streams of yesterday, from the backstreets of Africa to the defining roles of policymakers, the political realities of the African nation, balance of power, and a strive to sustain national interest and identity. Join us on Network Africa on Channels Television. Network Africa, a rallying point for the emergence of a new Africa.
On Network Africa this week, things are looking good, particularly in Nigeria concerning the Ebola virus. But can the same be said for some of the other affected countries?
With all the cancellations, the flight cancellations to Sierra Leone and the West in the Mano River Union, this is a challenge for us.
Then South Sudan has got more than a potential humanitarian catastrophe to deal with, as a plane is apparently shot down while doing a routine flight.
We received a report that one of our helicopters, an Mi-8, had crashed about 10 kilometers south of Bentiu in Unity State. This is one of the states that's most affected by the conflict which has been going on in South Sudan for some months now.
Also, as the Central African Republic still suffers crisis, children are bearing the brunt. And can you guess which popular Nigerian festival experienced a low turnout due to fears of Ebola? We'll tell you on today's program.
Because of the virus this year, we've actually experienced low turnover, but we hope that things will pick up next year. But next year, I hope they will find the vaccine for the virus and we'll not experience this again.
Well, we might be experiencing some good news as regards the virus in Nigeria, but the same cannot be said for countries like the Democratic Republic of Congo, where the outbreak of the virus occurred over the last weekend, or Liberia, in which a doctor died despite being treated with the experimental drug ZMapp. It's rather ironic because that was the same drug used to treat 2 U.S. aid workers who are doing just fine at the moment. Let's take some time now to examine how the virus is being handled by affected countries outside of the West African region.
Sad as it may seem, it's a reality, as the Democratic Republic of Congo has declared an Ebola outbreak in its northern Equator province after 2 out of 8 cases tested came back positive. But the World Health Organization believes that the disease, which had killed at least 70 people in Equator, was a kind of hemorrhagic gastroenteritis. Meanwhile, Sierra Leone's parliament took a huge step on Saturday, August the 23rd, as it has now made harboring Ebola victims a crime, punishable by 2 years in jail, in an attempt to stop the spread.
You can infect so many people, so I'm sure the president thought of that. That is why he decided that if you do home treatment, they will jail you for 2 years.
Lawmakers in Sierra Leone's capital, Freetown, voted overwhelmingly in favor of the 2014 Public Health Amendments Act, which amends a 54-year-old public health ordinance.
This is one of the positive moves made by the president. Of course, whatever laws that are put in place are within the context of the laws of Sierra Leone.
Underreporting of Ebola cases has been a problem, particularly in Liberia and Sierra Leone, currently the 2 countries hardest hit by the virus. Fear, stigma and denial have led many families to hide their infected loved ones from health officials. In other instances, patients have been forcibly removed from the treatment facilities and isolation centers, creating the risk of the disease's further spread.
We need to ensure that we enhance contact tracing, and we need to enhance the active surveillance to search for cases, and we need to improve on our case management so as more of these cases come in to our treatment center and isolation units, we are able to adequately address them in a timely manner.
As the outbreak has spread across borders from its initial epicenter in Guinea, Governments in the region have introduced increasingly strict travel restrictions.
With all the cancellations, the flight cancellations to Sierra Leone and the West in the Mana River Union, this is a challenge for us because most of our supplies do come in through aircrafts and commercial flights that come into the country, by the way. So the cancellation of commercial flights has created a huge a setback for us in the fight against Ebola, because most of our PPEs come through commercial flights. Most of the senior clinicians that we do have from W.H.O and other organizations come through commercial flights. So the problem we have is that has created a negative impact on the fight against Ebola for us.
The only upside in this situation of late occurred today when Japan announced that it would like to offer a drug to help treat the deadly Ebola virus before the World Health Organization officially rules on its use. Chief Cabinet Secretary Yoshida Suga told a news conference that Japan has received inquiries from some countries on the influenza drug Favipiravir, or T705 as it's known in the developmental code. Japan's Fujifilm Holdings Corp. and U.S. partner Medivector are in talks with the U.S. Food and Drug Administration to submit an application to expand the use of Favipiravir as a treatment of Ebola. The Ebola epidemic in West Africa has killed more than 1,000 people and prompted the WHO to declare an international health emergency.
During one of our programs, That's the World Today, I spoke with the Voice of America's health correspondent, Carol Pearson, and I started off by asking her what went wrong with the Liberian doctor who died in spite of being administered the experimental drug called ZMapp.
But what is interesting, the World Health Organization came out with a statement today saying that an inordinate number of healthcare workers have contracted the Ebola virus during this outbreak, and about half of them have died. 240 have gotten sick, 120 have died. And they looked at some of the reasons why this may have happened. One of it is that you have too few doctors dealing with with this huge outbreak, which means that they're working 6 or 7 days a week. They're working longer than is recommended with such a highly infectious disease. And when you work such long hours, you do tend to make mistakes. They're also talking about the fact that many of the doctors may not be trained, or healthcare workers may not be trained in how to wear protective equipment, and there may not be enough protective equipment to go around.
Now, Carol, despite precautionary measures being taken, is there something that, some of the affected countries don't seem to be getting right now that we have more cases like that in DRC, which is actually out of West Africa? Is there something that we're not getting right?
I don't think that it's so much something that's not being gotten right. It's that there are too few healthcare workers for the large number of people who have gotten Ebola. And now that they're focused on Ebola, it means that, maternal care other things are being ignored. I think it's just a matter of scarcity and the long time that it took for organizations besides Doctors Without Borders to get mobilized and to get volunteers in there to help the African doctors.
So, Carol, what are your last words concerning this? What do you think we need to do to improve the situation now?
People need to stop being so afraid. People need to comply with their government's requests of isolation, using hand sanitizers, using methods that prevent the spread of Ebola, and by reporting anybody who is sick so they can go to a treatment center.
Carol Pearson.